Alright, students, you're welcome to the concluding part of reproductive health. And let's quickly run through the learning objective. At the end of the lesson, you will be able to list the effects of STI and HIV on fetus and infant. You will be able to mention the risk involved in child delivery. You'll be able to state the importances of breastfeeding. You will be able to list the causes of infant mortality. You will be able to mention the causes of birth defects and other health-related problems. And you will be able to list the importance of the knowledge of genetic disorder in the family. The effect of STI and HIV/AIDS on fetus and infants. Of course, if a mother is infected with HIV means human immunodeficiency virus, while AIDS means acquired immune deficiency syndrome. So if a mother is infected with HIV/AIDS, there's actually probability that it can be transmitted to the baby, especially when it is not properly managed. Also, if a mother has STI means sexually transmitted infection, like your gonorrhea, your syphilis, your genital herpes. You must have been taught that in your previous class. If a mother is infected with STI, it can cause miscarriage for the woman. It can cause ectopic pregnancy. Ectopic pregnancy is when there is implantation outside the womb, and most of the time is usually in the fallopian tube. Then STI can also another effect of STI on babies or on the infants is preterm labor and delivery. Preterm labor is a labor that starts before the normal time, after maybe few weeks to 40 weeks, maybe two weeks to 40 weeks, maybe from 37. Any labor that comes before 37 weeks is regarded as a preterm labor. All right, so a STI can actually lead to preterm labor. Then STI can also cause low birth weight, and of course low birth weight can lead to lots of deficiencies in the baby that is being given birth to. It can also cause birth defects, including blindness, deafness, bone deformity, intellectual disability. Another effect of STI on fetus is stillbirth. The baby comes out and is lifeless. Another effect is illness in the newborn, especially in the first 30 days of the life of that newborn. Is in and out of the hospital. And lastly, another effect of STI is it can cause newborn death. Let's move on by looking at some risk involved in child delivery. The first risk we are looking at is breech position. Now, when you look at the picture, you can see how the normal baby comes out head first, but in this case, there are some cases whereby you see the baby sitting down, just like that picture. In such a case, it might be difficult for the baby to come out. That's a risk that you can see during child delivery. Another one is placenta previa. Placenta previa is when the placenta is covering the birth canal, that passage where the head is supposed to go through. Now the placenta is covering that particular point, so there's no way the baby will be able to push through. Another risk is placenta abruption. Placenta abruption is when there's a detachment of the placenta from the mother, and of course, once there's a detachment, you can see the picture, placenta abruption, you can see that there's a detachment. Once there's a detachment from the mother, there won't be supply of oxygen, there won't be supply of nutrients to the baby again, so it could lead to the death of that baby. And at that point where there's the detachment, of course the mother can start bleeding, and if the mother loses too much blood, it can lead to death of the mother. Another risk involved in childbearing is low birth weight. Low birth weight can actually make the baby have higher risk of respiratory infection, learning disability, heart infection, or it can lead to blindness. And lastly, another point we are looking at is prolonged labor. And when a pregnant woman is in prolonged labor, it can actually lead to the baby being tired. Once the baby is tired, it can lead to death of the baby. If the mother too is tired, it can lead to death of the mother. Let's move on. Importance of breastfeeding. What are some of the importance? There are lots of them, but we just look at few of them. It's a perfect food for the baby. All the nutrients in right proportion. It's all complete there. It's in there. All the necessary ingredients that will boost the baby's immune system. Everything is in there. Then another point is that it is more easily digested. Once the baby takes it, after a few hours, it is digested. It doesn't lead to constipation. It doesn't lead to diarrhea. Another one is that breast milk has just the right temperature. All right, so the right temperature in that is not too hot, it's not too cold. When we are preparing baby formula, you have to check the water. Is it too hot? Is it too cold? Then it can cause less illness because it's not easily contaminated. Then as the mother is breastfeeding the baby, it can actually assist the uterus to return to its pre-pregnant state faster. And lastly, it can help the woman to lose weight after birth. Let's move on by looking at our next learning objective, which is the causes of birth defect. What are some of the causes of birth defect? The first one is genetic problem. All right, is inherited. It could be inherited. Somebody has had this particular problem in a family before. It can actually reoccur again in another generation. Then chromosomal problem. In our last class, I mentioned chromosomes, that in human we have 46 chromosomes. If anything happens to it, is short, maybe by one, we have 45 chromosomes. It can lead to a syndrome called Turner syndrome. If it's more than, if you have 47 chromosomes, it can lead to what we call Down syndrome, and there are lots of them, lots of syndromes. All right, it can lead to any of them. So all this can cause birth defects. Infection too can cause birth defects. Infections, then exposure to medications, chemicals, or other agents during pregnancy, they can lead to birth defects. All right, let's look at this next subtopic: causes of infant mortality. When we hear the word mortality, what's the meaning of mortality? It means death. So what are the things that can actually make a baby or a young baby to just die suddenly? The first one is birth defect. In a case where the head is not properly formed, the limbs are not probably formed, the heart is not properly formed, the lungs, they are not properly formed, it can lead to infant mortality. Preterm birth or low birth weight, maternal pregnancy complication, sudden infant death syndrome. That's for no reason. The baby is assumed to be sleeping, and from there the baby passes on. That's SIDS. Then injury like suffocation, all right, can lead to infant mortality. In a case where a baby is coming out and the umbilical cord is tied around the neck of that baby, it can lead to infant mortality. Drug abuse on the part of the mother, excessive drinking and smoking can lead to infant mortality. Why do we need to know all this? Why are we going through all this? Why are we learning all this? One, it helps us in taking necessary precautions which might prevent developing the disease in you or your family. When you are aware that, okay, this particular genetic disorder has been in my maybe my forefather in my family, then you are able to take necessary precaution. And another importance of the knowledge of genetic disorder in the family is that advanced knowledge of genetic disorder in the family can inform you if possible condition or disease may be in yourself or in your kin or in your children. For example, if you have a family history of maybe arthritis, that's pain in the leg, or a condition of asthma, at least you're able to know, okay, this is what runs in my family and this is how to take precaution. All right, students, we have come to the end of the concluding parts of reproductive health. Thank you.